Cancer is the deadliest serial killer in the world. It kills more people yearly than any violent crimes combined. Despite modern medicine, complete cure from cancer is not possible in most cases because cancer usually has no symptoms at early stages, and when symptoms appear, it's usually already late. That's why screening is crucial. Screening means to do medical tests to detect cancer before any symptoms appear, even person seems healthy. Breast cancer screening is the first and most common cancer screened. Breast cancer is usually deadly, but if it's detected in early stages, treatment is very effective, and 5-year survival rate is 99%. It means if it's detected and treated early, the person has 99% chance that they will not die because of this cancer for next 5 years. Screening for breast cancer is done via mammography, which uses X-rays to detect cancer with almost 80% probability. It means mammograms is highly sensitive to detect cancer even in early stages. Mammograms are recommended annually for every woman over 40. In many cases, breast cancer has a genetical basis, such as mutations in BRCA genes. This mutation can be detected via blood tests. This genetical test is important because if woman has BRCA gene, it means 70% chance of get cancer in later life. The second most important screening test is for cervical cancer. Cervix is the lower part of a uterus. Pap smear or Papa Nicolau test is used for screening cervical cancer. During this gynecological procedure, cervical cells are taken as a sample and observed them under the microscope to check if there is abnormal cell which can be cancer or potential to become a cancer. Generally, cervical cancer is aggressive if left untreated, but when detected at early stages, it has high cure rate. 5-year survival is more than 90% when treated early. Also, before cancer occurs, person usually has human papilloma virus infection and changed or atypical cells which are not cancer yet, but it takes several years to develop cancer from such cells. If such atypical cells are detected and treated, cervical cancer will never develop. Pap smear is recommended for all women starting at the age of 21 every 3 years. The third most commonly screened cancer is colorectal cancer, which is also aggressive. It is the second leading killer cancer in the world after the lung cancer. Good news is colorectal cancer is highly preventable, means before the cancer occurs, usually there are benign polyps in the colon which can be found and removed during screening. In this case, cancer can be prevented. Even if cancer is already developed, if it will be detected at early stages and treated, 5-year survival of colorectal cancer will be 90%. Colorectal cancer screening method is colonoscopy. Another less invasive but also less effective option, tool-based screening for colorectal cancer. Eating high in fiber foods and regular exercise can dramatically decrease colorectal cancer risk. Screening is recommended for people after the age of 45 and people with family history of colorectal cancer. They should be screened earlier. Fourth, prostate cancer screening. It is detected via prostate-specific antigen blood test. If detected early, prostate cancer has a high cure rate because it is not aggressive cancer in many cases. Despite this, a prostate cancer is a significant cause of cancer-related death because it is very common. Any man has more than 10% of lifetime risk of developing prostate cancer. Screening for prostate cancer is recommended for men after the age of 50. The fifth cancer that can be screened is skin cancer. They usually have good prognosis if detected early. Any atypical moles, large moles with different colors inside and irregular borders, or large moles should be checked for melanoma. Especially people with long exposure to the sun have an increased risk of skin cancers. But remember, not all skin cancer resembles moles, which is why any unusual spots and growth on the skin warrant a check. The sixth is lung cancer. Generally, lung cancer is considered aggressive and difficult to treat, but early detection importantly improves survival. For example, in case of early screening and early detection, 5-year survival is 63%, whereas lung cancer diagnosed without screening typically in the stage of 3 or 4, and at this case survival rate is around 10%. Means screening and early diagnosis improves survival by 600%. Low-dose CT scans are used for lung cancer screening, especially among smokers. Is very important. The seventh cancer can be screened is oral cancers. It can be inspected during routine dental checkups, which greatly improves early diagnosis and chance to treat oral cancers at early stages.